So there's huge risk. And I always share that the top risk, and this is one that we can work on. The top risk financially for every patient, all of us, is not understanding our insurance benefits. Just because we think we have coverage. I cannot tell you how many times I get phone calls from folks who say, my insurance didn't cover X, Y, and Z, and now I have this big bill. And the truth is, a lot of times it's not that the bill could have been prevented, but the risk of being surprised by the bill could have been prevented if we had just reviewed our insurance benefits and had a better understanding of those.
Welcome. In this episode of the Hope Health and Wellness Advocacy podcast, we talk with Nicole Broadhurst of Tennessee Health Advocates. Welcome to this episode of the Hope Health and Wellness Advocacy podcast. I'm your host, Tara Adams, and I am thrilled today to bring to you a fellow private patient advocate and someone I've come to know as a friend, Nicole Broadhurst. Nicole specializes in medical billing, the aspect of healthcare. And, Nicole, you and I have talked in the past at length, kind of like what brought us to the point of creating our own businesses to help advocate for others. I wondered if you could tell us a little bit about your journey to becoming the CEO and founder of Tennessee Health Advocates.
Thanks so much, Tara. Absolutely. It's always good to share our stories. I think that that's what brings us together. And so I am always honored to have the opportunity to share my story. So thank you for having me today. I'm excited to be here. So I actually come from the world of corporate healthcare. I started my career in healthcare as a certified nursing assistant on the second shift at a skilled nursing facility. Now, for anyone who knows me today, that might be shocking because it is not my given gift to provide direct care to patients. I had an incident where it was really a traumatic situation where I went to turn a patient one afternoon. She was bedridden. And so we use sheets to kind of help us roll and turn patients. And in this particular situation, her skin caught, and just the mere movement of shifting her in the bed created a significant skin tear. I was really traumatized. It broke my heart to create such harm to another person. And I did all of the things that I needed to do. I filled out my incident report and promptly went to my director of nursing in tears and said, I don't think I can do this anymore. I'm not cut out for this work. She said, well, I had to let my administrative assistant go today. Would you be interested in that position? And I immediately said yes, because I got to continue working in the environment that I had come to love. I love helping people. I love being a part of a team that helps people. And so that started my journey on the administration side of healthcare. It also provided me the most amazing opportunity to honor and respect people who do provide direct patient care. So that's kind of where I started. It was an evolution for the next 27 years in healthcare administration. I worked at a multitude of facilities and providers, and ultimately ended up as a branch director for a private duty nursing agency in Nashville. I left that in 2018 and decided to start doing this independently in 2019.
Awesome. I love that story because you've experienced all sides of medical billing, administrative, all of that, and as well as the people experiencing the need for medical health care. So I love that you really know, you get it. You come from an empathetic background, and I love that because I think that brings another element to everything. So we're talking about today, we're going to be talking about advocating for patient financial safety. And I think that's an aspect that I didn't realize going into patient advocacy. I didn't realize even at that point, that there were people specialized in the medical billing, but almost thanking the Lord himself for that, because thinking, if there was ever anything you need an advocate for, someone who can, because at my worst and my many complex chronic health issues, that of my family, trying to navigate the complex, which is an understatement, medical billing and how things work, how they work in a hospital setting, how they work in a urgent care specialist, that like it, they work differently, it feels like. Lord help you if you need an appeal, or you know, you don't feel like they quickly assessed it correctly and you need more help. I mean, just all of it. And then getting a bill. I remember once, this was a lucky thing for me. I had apparently gone to the hospital for something that had resolved itself, so much so that by the time I got billing a year later, it was at least 10 months, if not 12 full months, I was like, what is this for? I mean, that's a real blessing to be able to say that at that point, I will say. But to also think I've written that off of thinking I needed to save for that, or do I even have this available to just, you know, pay? And of course, they want it due right now. They waited 12 months, but they want it right now.
This is so
So
true.
so God bless you and those of you that take on the medical billing aspect, because that is a true helpful blessing, and to take the tangled weave of medical billing and untangle it. Thank you. One thing I'd like to get a little clarification on, because you know, I've talked to you at length about it. I've actually personally asked for your help with some billing, so I really understand it. But for those looking at this video who are just starting to understand that there are patient advocates, and now their mind is blown that there are medical billing private patient advocates, can you explain a little bit about what you do for those that are wanting help with their medical billing?
Yes, absolutely. I'd be happy to do that. So, one of the things that I found in my corporate career is that I really enjoyed spreadsheets and numbers and people. So, a lot of times it's like, how do those all go together? So, so what I really do is I take all of the pieces of paper that patients get, right? Whether it's from the provider, it's a bill, this is due, or it's an explanation of benefits from the insurance company, or sometimes there's crazy letters from people that talk about, we can't process your claim because we don't know the following information. Will you fill out this 12-page questionnaire? Right? I mean, there's just too many pieces of paper, and it really gets overwhelming. And from my perspective, I'm just going to kind of put this out here. I just don't think that's fair. I think that it's unfair that we have,
I agree with
when
you.
we're sick, right? Like here I am, I'm chronically ill, or I have an accident, or I have, you know, a major new diagnosis, and I'm struggling with my physical health. And oh, by the way, here's all these pieces of paper we need you to figure out so that we might pay for your care. Like,
Exactly.
oh yeah. So I just take all of that. I organize it, I manage it, I put it into a semblance of something that anyone can understand. And then I present it back and say, this is what these pieces of paper mean, and this is what we need to do. So I take it all, organize it, and turn it into a clear action plan to figure so that we can, take the next step forward.
It's like you take the hieroglyphics and you translate it and make it so that it's a really easily translated version. And I love that, because you truly do. And I've heard the stories from those that have worked with you that, just it takes a load off to know and understand that that's not something you have to, deal with. As someone who's had a TBI and post-concussion syndrome, and who there was no possibility that I could understand any of that as plainly as it could be. I have to say, I really can appreciate what you're talking about there. So tell me, what are the top risks to patients' financial safety when we're talking about financial safety? going and not, what if they make a mistake and, they just pay what comes in the mail? Or what if they just ignore it? What if they're just like, listen, like you said, this isn't fair. I don't want to do it. What are the risks?
That's so true. So there's huge risk. And I always share that the top risk, and this is one that we can work on. The top risk financially for every patient, all of us, is not understanding our insurance benefits. That it just because we think we have coverage. I cannot tell you how many times I get phone calls from folks who say, my insurance didn't cover X, Y, and Z, and now I have this big bill. And the truth is, a lot of times that it's not that the bill could have been prevented, but the risk of being surprised by the bill could have been prevented if we had just reviewed our insurance benefits and had a better understanding of those. So that's one of the things I put out there for everyone. If you, this is not like, this is not entertainment reading, right? This
is dry reading at best.
It really is, but I've got a tip. I've got a tip to kind of help with that. And the tip is this: most of the time now, the document that we really need, it's called a benefit plan description. Okay. Benefit plan description. And it is a big document. It's usually between 100 and 250 pages. So it's not like, but the good news is, here's the good news. You don't have to read all of it. I'm going to tell you, like, you can typically get it in a PDF from either your member portal inside your insurance login, right? Where you go log in your insurance. You can usually get it there. And if you can't find it there under something like documents or contract or something like that, you can always call them and ask them to email it to you or drop it in your member portal so that you have it in an electronic format. Here's why you want it electronically. If you don't know this yet, this works in any PDF. You hit Control F. And it brings a search box up that says find. So if you want to find out about an MRI, or you want to find out about a particular benefit, you can type that in there and it will take you to that place in the document where those words are found.
Wow.
So, right? So the other words here, I'm going to even give you some words to type in that were really important. Type in the word exclusion. Because this will take you to the part of the document that specifically outlines what they will not pay for.
Got it. I bet, how long is that usually?
Okay. So it's really usually not too awful bad. Usually policies have, it's pretty specific, the things that they won't pay for. A lot of times, unfortunately, and this is not me, I have no opinion on this. This is just what I see typically, is that family planning, fertility treatments, those types of things are typical exclusions. Cosmetic surgery is a typical exclusion. And this might get into some of the reconstructive surgery following major weight loss. There are ways around that, but we can talk. But these are the things that I typically see as exclusion.
So get it electronically so we can search it and understand. You said something to me once when we were talking privately, and you said, understanding what your insurance is a contract. Understand what you signed as a contract, what they're contractually, and that you work to make sure they're upholding their end of the bargain so that we uphold our end of the bargain. And I thought those were some really wise words, and something that, I'd thought about before, but it wasn't so eloquently said or put together. But you're right. I mean, in other words, insurance, I think a lot of people, in a lot of situations I talk to them, they're always like, oh, no, that's covered, or that should be covered. I had a tree fall on my car and total it once, and people are like, oh, insurance will cover that. Oh, you don't need to worry about that. It's covered. It's covered. Guess what? It wasn't covered. was an act of God, and insurance has a good way of getting out of acts of God. And so I think people want to believe that. And I believe that's their sort of knee-jerk reaction to kind of help the situation, they think, to make you feel better, but they don't know. And I think people think insurance, that's what I got this for. It should have covered this, certainly, but they never checked the contract, the what did you call it again? Say it one more time.
Benefit plan description.
Benefit plan description. Yes. I, again, so eloquently, I wish I'd have had that terminology. I was doing that for my mom, actually about this time, about a year ago, because I was thinking she had a situation where she changed from skilled nursing to a different level of care. And I knew I was going to have to change things. And I wanted to compare apples to apples. And boy, did it take me a long time to try to convey to a representative. Basically, if I had that terminology, I feel like it would have gone a lot quicker. But basically, I just want to see, I got a lot of different documentation. I didn't get that, and in an electronic form. So I can appreciate so much you helping us to kind of dial right into what we need on that. So were those the top risk to patients' financial safety, or did we miss anything there?
That's really the first one, is understanding your insurance and what it covers. The next one is understanding what your cost sharing responsibilities are underneath that contract. So this is kind of where we're going to talk about a deductible, co-insurance, a maximum out of pocket, and what does that mean to me, right? Those are like, yeah, okay, I have a deductible. Okay, I have a co-insurance. Okay, but what does it actually mean? And this is something that I think is real. Again, these are like risk mitigation 101 for health insurance. Like, read your summary of benefits. This is just every year when you get your insurance, you get like a 2-page document that has a chart on it.
Mhm.
And on that chart, it gives you an overview of your benefits. On that chart, it gives you these really important numbers. And the first one is a deductible. And what does a deductible mean? It means that the insurance is not going to pay anything at all until I have spent my deductible amount. So if it's $1,000, then I have to pay the first $1,000 of my healthcare every year. They don't pay anything until that. Okay, so that's the first word. The second one is co-insurance. Co-insurance, and this is not to be confused with a copay. We're going to talk about a copay separately.
Okay, I was just going to ask you that. Yeah.
Copay and co-insurance are different. So we're going to talk about co-insurance first. So let's say I spend $1,000 on my healthcare and I meet my deductible. Yay. Now, from that point forward, and we'll talk about when it stops, but at that point, what happens is the insurance starts to pay some. They're not going to pay all most of the time. What they'll pay is maybe a 60-40 split. So maybe insurance will pay 60 and I pay 40.
Okay.
And this is going to be delineated on your summary of benefits. That square chart that you get, that's where you're going to find this information. So I spend my $1,000. Now I'm only responsible for 20%, and my insurance is going to pay 80%.
Okay.
My 20%, that's what we call a co-insurance.
Got it.
Okay. The third word is a maximum out of pocket, and that's my maximum amount that I'm personally going to have to pay for the entire year. So say it's $5,000. Okay.
Mhm.
So I spend $1,000. I meet my deductible.
Mhm.
Now I'm paying 20% co-insurance, and the insurance company is paying 80%. And as soon as my $20,000 hits $4,000, because remember, I paid $1,000 to get started. Now I'm at 5 total, right? As soon as I hit that point and I've hit my maximum out of pocket, my insurance is going to pay 100% now for the rest of the year.
And that does not include the copays, though, generally.
A copay, that's right. A copay It does include co-insurance, but it does not include copay. A copay is a flat amount that we have to pay for a service, and it has nothing to do with our deductible or our co-insurance or our max out of pocket. It's a copay. We have to pay it regardless. Okay.
That's our skin in the game. Do you really need
That's
to
right.
go to these places? You're gonna have to
Right.
put a little bit into this to go.
That's
But
right.
I think copay and co-insurance does get confused, and I've known
It
the
does.
difference, and yet I still, when I go to either talk about it or look at it, I could easily confuse the two, which is a big problem when you're trying to navigate and pull apart what's going on here. Yeah. So I'm glad you know the
Exactly.
difference and can stick with it.
They do get confusing. So
Well, it feels like, as the patient, it feels like the same thing. I'm still paying, whether it's a copay or co-insurance,
right.
I'm paying. And I feel like that's where the confusion probably ends up, as the patient who's looking at the billing. Whereas, an objective person could be like, no.
Right. Those risks are risks that I hope that, we can all learn, so that part of it doesn't need an independent advocate. If we can, share this information openly and widely, then that piece of the risk will be diminished, hopefully eliminated. I don't know that that's going to happen, but maybe that's my goal. I'd love for no one to
Well, I
ever
will
be at
say,
risk for those again.
since meeting you and reading your website and having you tell me these, it's really helped to reinforce some of the things that I probably knew, but like I wasn't really just putting it in its right place in my mind. And then it also helps with not the shock. The shock puts you in a bad frame of mind to deal with the financial issues, because it feels like it's a never-ending black hole of needing money. Like, where did you come from? I never saw you in the emergency room. Like, what do you want? Like, everybody wants a piece of the pie. It can get kind of overwhelming and confusing, and it just puts you in the bad frame of mind. So to your point, if you kind of just take a minute, take a breath, and then think about, this is what I contractually agreed to in instances like this, and this is what they're saying is happening, what they're billed for, and this is our part. I think that really does. It has made a difference for me personally, I can say, and I appreciate that.
Good.
Well, let me ask you this. Let's go this direction. What can we do to mitigate risk? I mean, there's the knowing. Knowing is half the battle, at least according to G.I. Joe. So now that we know, what other things can we do to mitigate the risk?
Biggest things we can do are, like I said, read our policy, understand that. I think that really the other pieces are options inside of healthcare, right? Because here's the thing, the most expensive place to go for treatment is the hospital.
Yeah.
Right? Even for lab draws, even for imaging, even for x-rays. And here's the rub with that. The reason that it's the most expensive place to go for those services is because they have the most resources, right? They have the most resources available to them. They're a hospital. They're treating people in a very acute moment. So they have, most of the time, they have the latest and greatest equipment, and they have, all of anything that could go wrong, they'll be ready for you. Well, I have my lab, I need my blood drawn regularly for lab work, for chronic things. But I don't necessarily need the depth of the resources available at the hospital to draw my blood. I could go to a freestanding lab to have my blood drawn, and it's going to be cheaper there.
Right.
So, it's the same thought process of, do I need an emergency department, or do I need an urgent care clinic?
Exactly.
Or do I need a doctor's visit? Or, right. And really getting strategic about utilization, how we use the healthcare system. Because when we use the most expensive option, it costs the most.
Yeah, for sure. Well, and I wonder because, I'm here in Arizona, Phoenix area, and so it is a metropolis of many, many options of kinds of care, to what you're describing. And so the options are available in huge numbers, but that may not be the case everywhere. But also, when you're talking about know your options, there's also options in the type of insurance, because going back to what you said before, typically speaking, there's, you could pick a $500 deductible. You can go to 1,000. You can do even more. I worked somewhere once where we had like a $2,500 deductible, but then after that, it covered at like 95%. And the idea with that was because at the time I was working in it was a naturopathic medical college. And typically, licensed naturopathic doctors are not covered under most insurance plans, even though they are trained like regular medical MDs, DOs, other licensed doctors in every state. They're not recognized in every state. That's a whole other topic. But that is a care that I have really enjoyed and that I do promote and talk about a lot. And there are holistic, alternative medical options that typically insurance may not cover. So when you have a high deductible like that, you are still covered per se. And in that, you're going to pay that deductible, and you still pay that deductible. Insurance will take that on as part of your deductible. You just get to choose where you go for that. I think it's at the point that you met the deductible, and then you're at the 95%. Well, now you have to be within their network, and you have to meet their criteria that's in the contract that you agree to when you say, yes, I would like to get insurance with you. But there are options, like you could do, like so other people call that catastrophic, I guess. In other words, you don't really need healthcare. Maybe you're really healthy and you just want something to cover basically a hospital bill should you get in a car accident or something unforeseen happens and you need to get medical care. But there's different options. There's different things you can do. There's co-ops. There's doctors now that you can pay them so much as a retainer almost every month.
Yes.
And get certain amount of services as like a primary care. And so there's a lot of different options. And again, maybe I'm talking so much because of where I'm at, and those are a lot of options we see here that may not be across the board, but it's good to know what those options are. Would you agree?
I absolutely agree. I absolutely agree. Interesting enough, specifically, I think one of the things that are pretty much across the board, I would suggest that at a minimum, understanding the difference between an HMO and a PPO would probably be super helpful. An HMO is a much more limited network. So your options will be more limited, because I see a lot of times those are the options, right? I can get this plan that's an HMO, or I can get this plan that's a PPO. And that's pretty much, like, if you want to boil it right down, that's the difference. A PPO has more choices for providers than an HMO does.
Yes. And I'll just say, as someone who has chronic health conditions that a lot of doctors, it's taken years for them to recognize that these are real conditions and not just hypochondria, that, it behooves someone in my condition to go with a PPO, because, and this is a very general statement, this is not across the board for everything, but I would say my 49 years on earth has shown me that typically the doctors that specialize or are getting good at the complex health issues that others may not really be that well versed in are generally outside of an HMO. And HMOs have a certain amount of people and they get filled up really quickly, has been my experience as well, and talking to others too. So that was really good. I appreciate you brought that up, because I've cut out HMOs for so many years just because of my health problems. I forget they exist, but and that's some privilege that I enjoy. And I understand that not everybody has that option, but I love that. Well, let me ask you this. This has been great information, and I encourage people to go to your website. We're going to have your website and other information of how they can get information from you to help themselves advocate for their financial safety. But how can someone find a medical billing advocate? Obviously, there's you, but there are others, correct?
There are, absolutely. There are others. It's a growing industry. And so that you have options, you can vet us. There's several places. So I'm going to kind of give the websites and you can then include those in the notes as well so that
Yes.
people can get there. So one is GNAnow.org, and that stands for Greater National Advocates Now.org. And so they have, I want to say, I think there's 400 or 500 advocates listed there, but all kinds of different
Quite a
advocates. You
few.
can,
Yes.
yeah, you can look for billing advocates. You can look for an advocate to help you in another area. Like there's lots of options. The other directory that I love to use, and I have a personal, like I'm a member over there, it's advoconnection.com. And that is through the Alliance of Professional Health Advocates, APHA. Yes. Acronyms, I got to make sure. So the Alliance of Professional Health Advocates, that is advoconnection.com. And again, you can sort by location, you can look by specialty, all of those things. So those two directories are the ones that I think have the most resources. There are two more, and I'll throw those out just for general purposes. The
Okay.
other one is the National Association of Healthcare Advocacy, NAHAC.com. And the last one is healthadvocatex.com. And they all have directories, and they're professional organizations, and I'm a member of all of them. So I feel really comfortable and confident saying you'll find somebody that can help you there.
That's awesome. And they don't necessarily have to be like you're located in Tennessee, but they wouldn't have to be in Tennessee for you to work with them, correct?
That is correct. I have clients around the world right now. I've got them from New York, Florida, California. I'm just started working with a client in Singapore. I have one in Japan and one in Thailand. So yeah,
Wow.
location's not an issue.
That really surprises me. I really thought it extended to, the states because of the kind of healthcare. But I suppose if someone is using insurance, but they're located, I guess there's different
So that is
backgrounds to that.
yes, I know that's a whole nother show, but you are exactly right. I'm working with folks who have United States health insurance and they're using out of network international benefits. And I'm assisting them with filing those claims with their insurance. So that's a whole nother
I know.
discussion.
I've got to get you back
yes.
for that. I want to discuss that. What is that about? And what I would love to get the reactions of those internationally with you getting to talk to them about, well, understand this. This is how it works here in America. Yeah, I imagine that's quite a lot.
It's great. It's a good experience for all of us, I think.
Well, thank you so much for talking with me today. I appreciate it. One of the things I always like to ask people that I interview is their favorite recipe. And I'm wondering if you would share with us today your favorite recipe and why it's your favorite recipe.
So I make stuffed peppers. I have a stuffed pepper recipe that I absolutely adore. And I'm going to tell you why. It's meatless. It is a cheese, pepper, and water chestnuts
Oh, I love water
baked.
chestnuts.
It is, I love it. I absolutely adore it. I try to steer from red meat. And so I'm trying to move into, other options. And stuffed peppers have been my favorite meal since I was a young girl. Like my mom made stuffed peppers and they were great. but I wanted to kind of change that. So I've been trying, and it's wonderful because I just found this recipe in the last 6 months. So I love that you asked me that. But I got to replace my mother's traditional stuffed peppers with a cheese stuffed pepper, and it's delicious. So
Awesome.
it's got feta cheese and Parmesan cheese and water chestnuts, and it's delicious. If you
Wow,
want
it
it, let me
sounds
know.
like it. I can't wait to try that myself. Wow. Well, thank you so much for sharing that with us, and thank you for educating us today, helping us to advocate for ourselves. Definitely would love to have you on here again to talk more, because I don't think this topic can ever end, really, it feels like. But thank you so much, and we look forward to having you again.
Thanks, Tara.
Be empowered. Be your own self-advocate. Check out our website, hopehwa.com.